Now we will turn to session 3, and we are going a little bit faster to catch up on time. So bear with us, and we will try and take questions at the end if we can. If not, we will answer the questions and circulate them as promised. I would like to invite back James, who will take us through this next session, future directions, learning for change, and it's the last session for the forum, and we will steer our vision to the future and explore opportunities as to the future of what do you do with the patient narratives using care opinion. What are the opportunities for research and innovation, and an area which in Australia we need to do a lot more in and learn from our UK colleagues. Dr. James Munro will take us on a journey of care opinion as a data source, a people source, and an intervention in its own right, illuminating what we are learning from a range of disciplines, including social policy, sociology, social psychology, and machine learning, and what future research direction holds promise in helping us understand how online feedback fits into modern healthcare systems and how we can use it to improve care and quality. Thank you, James. Please take us away.
Great, thanks. Thanks very much, Tina. Nice to be back again. Well, caffeinated up now after the early start here. So I'm just going to quickly share my screen, and it's going to be a bit of a gallop through some of the research that we have available. I think we'll be touching on many of the themes that we've heard from other speakers discussing, including that last one from Justin and Francis, which I thought was fascinating. So we're going to talk about the online feedback evidence base, and there is a surprising amount of research evidence now available on care opinion specifically and online feedback in general. I'm going to dash through some of that and highlight some of the most interesting things that we're seeing in the research evidence that we now have. So as Tina mentioned, we can think of care opinion in relation to research in a number of different ways. And obviously the thing that most people focus in on straight away is the stories, the number of stories, how many are there, where they're coming from, what's they about, what are the themes, and so on and so forth. That's a primary focus for people. We shouldn't forget also that amongst that data, it's not just the stories, but the responses. And I'll show you later some early research looking at responding, and there have been a number of studies about responding on care opinion too, and I think that's a data source we can really learn from. So we should also remember that actually the stories are told by real people who are still there listening and wanting to see their feedback lead to change, and indeed staff are using the service too, and we saw from Francis just now some feedback from staff about their experiences of care opinion and how it impacts on them. And so care opinion is also a resource of people who may be willing and able to help in various ways, whether with research or with education or with improvement projects. There was talk earlier, I think from Tina Bertoloni, about co-production of bringing people into improvement projects. So we can think about that too. And then care opinion as an intervention in the health system, not just as data, not just as information, but as ways that we could think about care opinion as an intervention for creating higher quality, safer healthcare for everybody. So we have a long history of research collaborations with different academic institutions, including institutions in Australia. And I know there is some research interest within Australian universities in working with care opinion data. But we've worked with a number of UK and US and Canada and Irish universities over the years, and there's still a lot of activity going on in various places. We have a few new projects that we're brewing up at the moment. So let's just start off thinking about care opinion as qualitative data, stories as qualitative data. And there have been quite a number of studies now analysing particular topics or particular conditions or procedures within care opinion feedback. And you can see some examples of those here. There's that paper top left was about safety for people with learning disabilities. And that work was done during lockdown here in the UK, and it was able to proceed because Care Opinion became a data source that allowed a qualitative analysis of safety issues for people with learning disabilities and their families. I should say, before you worry about all these papers and how you might get hold of the ones of interest, that they are all listed on our research outputs page on the UK Care Opinion site. So that link's at the bottom there. If you click on the Care Opinion site, any page, if you click on the research link in the footer, you'll be able to follow through to the research outputs page, and indeed our research chats, where you'll be able to see we tend to talk to a lot of these research authors and have a regular chat online. We've recorded all of those, so you can go and have a look. You can see this paper bottom left is about end-of-life care. The one on the bottom right is about amputation care, what matters in amputation care for people. And the one at top right is about what people say on Care Opinion about their psychiatrists and what things matter to them, and whether they're reflected or not in the validation in the surveys that are conducted by the regulator and by Royal Colleges. And it turns out they're not. So that's a really interesting paper if you're interested in the quality of mental health care. So we can also think about stories as quantitative data. There are ways to quantify the stories that we have on Care Opinion, and one of these papers has already been mentioned. The one at top left, Alex Gillespie and Tom Reeder from LSE did a fascinating study, and there's a link to this paper in the chat. If you want to pop back up the chat, you'll be able to find it. This was an analysis of 146,000 stories on Care Opinion, analysed by machine learning to detect safety issues being reported by patients, which had either been unnoticed or unresolved by staff. And one of the fascinating things about this study was it also showed that actually when you aggregated the data up to hospital level, it turned out that the stories on Care Opinion were associated with hospital mortality. In other words, the more safety issues that people reported about a hospital, the higher tended to be the hospital level mortality. Even more fascinating was that in the national patient safety reporting system that we have in the UK, staff reports of safety issues were not correlated with mortality. And so it seemed to suggest that actually patients might be a better indicator of hospital safety, or perhaps safety culture, than staff are. So that's a paper well worth reading. It's a bit technical, but if you jump straight through to the end, you'll get the gist. And this one at bottom right suggests in a similar way that feedback through Care Opinion and through other sources online can be analysed to predict the scores allocated by the regulator in England, CQC. In other words, it may be that, for example, stories on Care Opinion could be used to direct the efforts of regulators towards areas that they need to be looking at more closely. So let's just mention briefly authors as research subjects. So this is the Care Opinion as a source of not just data, but of people. And this is something we've been developing with the University of Leeds over the last few years, and it's still to some degree being piloted, but we're hoping to open this up to all subscribers soon. So this is something we hope to be able to offer you in Australia in the coming year. But this is about developing a research community, and currently our research community in the UK through Care Opinion is around about 1,500 people. So these are people who've consented to be contacted if researchers are looking for participants in their projects whose preferences match those of the author. So it's about finding the people that you need to talk to for particular projects. We've published a number of papers on this. So this first one is just about the principles and how it works and whether people are willing to do this. And then this second paper was a specific paper about delayed transfers of care in older people. And this was based on research participants who'd been found through the Care Opinion website. We've supported 4 studies with Leeds University so far, using Care Opinion as a source of people who are willing and able to help researchers conduct their research. And I think this is an approach which is, I mean, still very much in its early days, but it's really interesting because we could broaden this out and think about, can we use Care Opinion to find people who are willing and able, for example, to help teach medical students or to share their experiences with nursing students, or to come along to the local healthcare facility that they use and help with improvement projects, for example. That was something that I think Claire was talking about earlier from WA. So that's just another angle. And then we've got care opinion as an intervention. And again, this is an area where there's been a significant amount of research now starting to build up. Early work like Maltese-Evitz's work on care opinion and the impact of stories as they move through the system. But then a number of others, Louise Lowcock from Aberdeen University, top right, talking about how staff react to care opinion stories, picking up some of the themes actually that were mentioned earlier, particularly around how anonymity can be a challenge for staff, and they can sometimes feel that if somebody remains anonymous, then their story is in some ways less trustworthy, if you like. So exploring that issue. The one bottom right, this is one of the papers coming out of Emma Berry's PhD on care opinion at Aberdeen, talking about the work of feedback moderation at care opinion, and the in a sense the intervention that care opinion moderators are making in the healthcare system in the way that they moderate and then alert staff. And then bottom left, there have been a number of papers from Lauren Ramsey, who also did her PhD on care opinion. This is at University of Leeds again, looking at how different healthcare organizations react to, respond to, feel about online feedback, those that wish to engage, those that don't wish to engage, and how that depends on the culture of the organization. So those are all fascinating papers. And actually, just to pick up on something that's come up as a theme all the way through our discussions today, the importance of positive feedback for staff. And that was, again, something that Francis just mentioned in the last talk, the well-being of staff. And this is a research study, a review of research studies, in fact, that was just published earlier this month, led by Stefan Rennick-Eggleston of the University of Nottingham. And this scoping review looked at 68 studies of the impact of positive patient feedback on staff. These studies have been conducted right across the world in all parts of the globe. And consistently, these studies show a range of effects, of positive effects on staff from positive feedback, as you might expect. And the most obvious one being, short-term emotional boost, if you like, but also suggesting that there are other deeper and wider impacts from positive feedback on staff. So lifting morale, confidence, and pride, we've talked about, longer-term well-being at work, improvements in relationships at work between staff within teams, improvements in absenteeism and staff resilience, decreased staff turnover, for example, decreased staff burnout, and improvements in home relationships, astonishingly, as well. And two of the studies suggested there may even be improvements in performance at work, and ability to continue to carry out care. So the effectiveness of care, if you like. And this takes us back to where we started earlier today, this notion that the positive feedback that patients share is making a difference to staff in ways that improve the quality and safety of care, which is what patients want. So again, it's that virtuous circle of feedback leading to better, safer care for everybody. So that's a really interesting paper to go and look at. I mentioned earlier about the importance of looking at responses. Responses to feedback are also a resource for research. And this is another paper, not yet published, but in draft, from Alex Gillespie and Tom Reeder at LSE, where they're looking at, can we measure responsiveness, defensiveness in the responses that people post online? And they believe that we can, and they, again, are using machine learning techniques to detect defensive tactics in responding. And because Alex comes from a social psychology background, this is something that he's very familiar with, looking for linguistic patterns, comparing stories and responses over large numbers of stories to look for defensiveness. And again, suggesting that engaging with online feedback can help the organization, as he says here, create a good safety culture. So that's that's really interesting. And there is some early evidence, not yet published, that actually using care opinion can result in, if you like, a reduction in defensiveness of responding over time. And I think if that's true, then it might also mean that perhaps wider culture in the organization can gradually become less defensive over time. And I think that would be a very significant and exciting finding. But that paper of Alex's isn't out yet, so we'll have to wait a little bit longer before we can be sure what he's going to say. So there are things we know and there are things we don't. Many of the things we know, as I say, you can find on the research outputs page on Care Opinion. Well, things we don't know, but I think we'd like to know, are much more about the impact over time of using Care Opinion. We have lots of studies where people are just asked, what do you think of the idea of online feedback? But what we need is studies over time, longitudinal studies of what is actually the impact of using Care Opinion over time on patients and on staff and on the culture of teams and the performance of organizations. And we know very, very little about that. And I think that's such an important area for research. If Care Opinion is an intervention, what effects does it produce over time for health systems? We don't know much about the relationship to formal complaints. That's been touched on earlier. We are hoping that there will be new research starting in this area from Edinburgh University next year, but we're not quite sure whether that's going to get funded yet. But that's an area of live interest. How do people select between giving online feedback, making a formal complaint, and how do those routes to feedback, critical feedback, how do they affect staff and the ability to learn and make changes and improvements in care? So that's a really interesting area. And then this whole area of Care Opinion as an intervention isn't yet studied sufficiently either, I think. We're working up ideas with the University of Nottingham around could we be more deliberative about or deliberate about gratitude as an intervention in the healthcare system, and could we provide a stream of gratitude and measure its effects on staff, teams and organizations over time? How could we do that? So that's an area we're really interested in. And then, of course, this safety issue detection. We're working with the University of Leeds in the area of what they call safety intelligence, soft intelligence. Can real-time feedback through Care Opinion be helpful in avoiding safety lapses in organizations? So lots of things we still need to know about online feedback. And I'll just finish up with this tweet. I do like a tweet, as you know. I think I picked this tweet because I think it's a really interesting example of the kind of culture that we think that it's possible to create or foster or grow through the use of online patient feedback. So this is from the emergency medicine team in Edinburgh. They say in this tweet, sometimes we get it wrong, we're sorry, we'll learn and improve. The greatest value in patient feedback is in highlighting the areas we need to build on. So this was a response to a critical story about their care. And I think what's fascinating and important about this is this not a defensive response at all. It's a very open, accountable response, which talks about the need for learning and change. And I think that if we can grow that kind of culture right across the health system, we'll have done incredibly well in our efforts to improve the quality and safety of care. So I'll stop there because I know we're in a bit of a rush, and hand back to Tina.
Thanks very much. I think, James, that's very insightful and so much learning for us. And as a geeky academic by background, it's music to my ears, and we look forward to continuing to do more around research and innovation with Care Opinion.